Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me on the program.
Yes, sir. Could we begin with our latest vaccine numbers, and if you can, a breakdown of how the regions are performing?
Well, as of yesterday, we've had, for persons who received their first dose vaccines, we've had 224,853 persons. This would be approximately 46.2% of our adult population. And for second dose, persons receiving their second dose or becoming fully immunized, we had 94,243 persons. That represents about 19.4% of our adult population. In terms of the region, Region 1, we have 55.9% of their population receiving the first dose. Region 2, they're at 42.4%. Region 3, 45.7%. Region 4 at 47.8%. Region 5 at 49.3%. Region 6 is at 54%. Region 7 is at 45%. Region 8 is at 29.6%. Region 9 is at 43.5%. And Region 10 is at 14%. So this is the breakdown for first dose.
All right. I know that previously we had spoken about those regions that have challenges, especially with the terrain. I noted that in Region 8 you had 29%. Have any of the teams reported, especially with the rains now, have they reported any sort of delay in administration of the vaccine?
Well, it is certainly challenging in some of the communities, especially those that are affected by flooding. And in some cases, like in Region 8, because of the mountains and so forth, it's difficult to reach some of the communities. Nevertheless, the team there has been trying, and they've been, despite all the challenges, have been working to get people vaccinated. We have seen a decline in the numbers that we are reaching, but we are still persisting. Similarly, we've had challenges in 9 because of the flooding there. But again, we have several teams that are out, and they're working to do vaccination as well as doing surveillance on waterborne diseases. We have seen an increase in Region 1. And as you would note now, Region 1, based on first dose vaccination, they're ahead. And again, we have several teams that are operating in Region 1, and hopefully, despite the flood, they will continue to be able to do that. In Region 7, they have embarked on a house-to-house campaign within the Bartica area in the hope of getting more people vaccinated. And in the upper and middle Mazaruni, it is quite flooded, and so the teams are having challenges. So they're doing more observation for waterborne diseases. But they also have teams there. If people are willing to get their vaccines, they'll be able to administer it.
All right. Would you be able to give us an update on Region 2 in the Pomeroon especially? I know that you've had some additional personnel go into the region.
Again, last week we had several teams that went into the Pomeroon, and on that occasion I think we were able to do about 300 vaccination in the Pomeroon. Those efforts are going to continue, and on this weekend we have, I think on Friday, we have a drive-through at Anna Regina car park. So hopefully we'll start seeing the numbers in Region 2 going up.
All right, thank you, sir. I wanted to take you away a little bit from the vaccines and just ask you for an update on the smart hospitals.
Well, as you know, we have 5 hospitals under this project. So Diamond is now completed and back in operation. We have Lenora that is substantially completed, but there's still some works to be done. We are optimistic that we'll be able to get that hospital within the time frame of the contract so that we can reopen it to the public with all the new upgrades. In Region 1 and Region 9, we are having a bit of a challenge because the contractor is not on schedule, and we have been working with PAHO, who's been supervising the contractor, to make sure they bring them back on schedule. So hopefully we'll be able to get those projects on time as well. But we've been working through PAHO, who's managing these contracts, to make sure that the contractor comply and do quality work as well. And this is both for Region 1 and Region 9, because it's the same contractor that got both of those hospitals. We continue to work through PAHO to get a contractor to start in Paramakotoy. That project has not started as yet, but we are hopeful that we can get that going very soon. In addition to these 5 hospitals, we also recently signed an agreement with a company in India to start the design of the 3 hospitals under the Indian grant. And these hospitals would include the West Demerara Hospital, the design of the West Demerara Hospital, the Anna Regina Orsatti Hospital, and the Bartica Hospital. So that contract has now been signed with the company that would have won the bid. We went out to tender, this company won the bid, and we have now signed a contract for them to do the design works for these 3 hospitals. So once that's started, we anticipate that maybe within 9 months or so they would complete those designs, and we'll be able to go out to tender to get a contractor to start doing the actual works.
Okay, great. My last question I have for you, we observe World Blood Donor Day on the 14th. If you can, what was the response like from members of the public?
So last year we saw a drop in the amount of blood donations that we receive. Generally we will be able to get maybe about 12,000 pints of blood donated. And last year we saw a reduction. We probably received just about 9,000 units of blood. And that created some difficulty for us because, blood, we use these units in emergency setting, people who require emergency surgery or mothers who require such transfusion. This year, we have been on target, so hopefully we'll complete the year achieving the targets that we have set. And during this particular week, we have had several outreaches, going to public spaces, encouraging people to donate blood. And I think that has been quite positive. But we'll continue to do so to make sure that the public is aware of the importance of donating blood and that they can come out and give blood, because by giving blood we can actually save persons who require these emergencies, save their lives.
Thank you so much. Just one follow-up question. Do we have any particular blood type that might be lacking, or so we have a particular shortage in?
Not necessarily, but we appeal to everyone who is willing to come out and donate.
All right. Thank you so much, Minister.
Thank you.
All right, well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.